those records, big time red flags. And keep in mind that, I was talking about, maintenance, regular treatment records. They have to apply to what you have and, when you had it. So, if you had a herniated disc and it was so bad that, you had to stop working, we'd want to see records from an orthopedist.
Yeah.
We wouldn't want to see, a record from, once again, your PCP, Dr. Jones, unless you'd been to Dr. Jones and Dr. Jones says, oh my goodness, my patient's come in and he's having a hard time, even getting off the exam table. I'm going to refer him to an orthopedist. Well, we'd want those records too, because now all of a sudden we're building the bridge, and that could actually help get all the way back to when you said you became disabled. So that would be helpful. But, for things like musculoskeletal problems, we'd want to see orthopedic records, rheumatoid arthritis, rheumatologist, for, cancer conditions, we'd want to see oncology reports. For mental health stuff, we'd want to see some therapy notes, something from a psychologist or a psychiatrist, those kinds of things. And always, if the condition is so bad that it's required an inpatient stay, either a surgical note, outpatient surgery notes are absolutely fantastic for us, but inpatient, okay, the surgery was so serious that they had to stay for a few days, or like we talked about before, their mental health was so bad they had a breakdown, and they needed some time to be significantly treated, and so they were institutionalized, or they were in an inpatient treatment center for a while. Those records, big time red flags. Those are the type of records we see on folks who are disabled.